Hello everyone, let's talk about breast augmentation. Increasing the size of the breast can be done either using silicone or using your own fat. While choosing breast augmentation with silicone implant, the patient and the doctor discusses regarding the shape of the implant, size of the implant, pocket selection, that is plane in which the implant is inserted, then the incision where it's going to be placed. These are the common things, and the post-op complication and post-op period, etc. Let's go one by one. So with regards to the choice of the size of implant, I normally ask my patient to bring a bra of size that they desire. Then we take different sizes, we insert inside the bra, we wear a tight fitting dress, and then I ask the patient to see in the mirror, to look at the projection and how the appearance and whether she is happy with that. In addition to this is patient's desire. We also take measurements regarding the size of the chest, how big an implant we can accommodate based on the patient's desire. So considering both of this, the size of the implant is chosen. Then after this, we talk about in what plane the implant needs to be inserted, whether it is over the muscle, under the muscle, partly over and under the muscle. So this will depend on the soft tissue thickness of the patient themselves, the skin quality, and whether they are involved in vigorous sporting activity or dancing, exercise, so that if it's below the muscle, when the muscle repeatedly contracts, there is a chance of what we call animation or the implant movement being visible. So based on this, the pocket selection is chosen. Sometimes if a patient has a sagging, we also have to go partly under and over the muscle to also give an internal lift. This is pocket selection. So after pocket selection, then we choose whether the implant they would prefer to be inserted under the breast or through the armpit or around a periareolar insertion. This again will depend on the pros and cons for each and what the patient and the doctor, after both of their discussion. Once the implant size, the pocket and the incision is all selected, then before surgery you are asked to undergo a mammogram if you're over 40 years or ultrasound of the breast to make sure that there are no calcifications or some lump that we want to record before the procedure. Then patient understands the post-procedure recovery period. The whole procedure takes about a couple of hours. Patient is in the hospital for a daycare procedure. They go home. They have to be indoors, but bed rest is not essential. And after 48 hours, we see them again, and everything is okay. They can resume normal activity. They are advised to wear support bras for a couple of weeks, and after that, they go back to their normal fitting bras. Now, when it comes to fat grafting, patient's own body fat is taken and inserted into the breast tissue to give the enhancement. So first, we need to be able to harvest sufficient amount of fat to prepare pure fat to be inserted. Now, fat is inserted in different planes. It needs to get blood supply after insertion for it to survive. So after fat grafting, usually almost 50 to 60% of the fat can get absorbed. Anywhere from 20% to 60% fat that is put in can get absorbed, which means to achieve your desired size, you might have to repeat it a couple of times. Not only that, silicone has a definite shape, so when you put the silicone implant, you get a great cleavage and you get a great takeoff. But when it comes to fat grafting, may not be always possible. Also, the amount of absorption may not be equal on both sides, and it has its own limitation. But the advantage is its own native tissue. Usually, we add small quantity of fat grafting to most breast augmentation using silicone to give a nice cleavage or give a nice upper pole fullness. But there we use very less amount of fat. When you're using only fat to give an augmentation equivalent to 350cc or 350cc, then it's a significant amount of fat, and if that gets absorbed, during the process of absorption, it can form what is called an oil cyst. Now, if the oil cyst becomes encapsulated, then it recurs again and again. You have to keep aspirating. So these are the advantage and disadvantage of breast augmentation with fat grafting versus with silicone implant. Now, post-procedure complication with regards to an implant, you can have what is called an infection of the implant. Very difficult to control infection with the implant in situ. Then you have to remove the implant and we reinsert after 3 months on the side where it is infected. Second, there is something called capsule contracture. The body forms a shell over the implant, and this shell, if it tightens over the implant, you have a severe pain and it feels like somebody is squeezing your breast. Then again, we remove the implant on that side and reinsert after 3 months. Rarely, there are reports of certain specific type of cancers called ALCL or squamous cell carcinoma, which are associated with breast implant. They do not say that the incidence of cancer is higher in somebody who's undergoing a breast implant versus a normal woman. It isn't so. However, you can get types of cancer which are not native to the breast in those who have implants. But at the same time, when you do fat grafting, you can develop oil cyst, you can develop infection. When you have oil cyst, you have to keep repeating them multiple times. So if you're planning to do breast augmentation, you have to know the pros and cons of both the procedures. You have to understand the procedure well. It is a very safe procedure done throughout the world. It's one of the commonest cosmetic procedures that is done. You have to know the size, decide the size of the implant, the plane of the implant, the incision, downtime, and then choose which of these two procedures will give you the satisfaction, the desired result, and a long-term happiness.